I did want to take this back to the very practical, because I'm sure you're getting this question as you talk to others, to other clinicians and family members, and they call and they ask, do you have any special advice? What should I be doing? Where is this going? This is your opportunity to...
Thank you for that question. It is the most common one I get. I also think it's the most important one. And let me frame it this way. I think our greatest opportunity, and at the same time our greatest threat, is human behavior. The most contagious disease known to man is fear and ignorance. And the reason I stressed earlier in our time that this is a pandemic is not to cause fear or panic, but to cause preparedness. And the term that I'm using and getting ready to publish a paper on here is what I call contextually appropriate layering of protection. So, Colin, just as an example, you went off to West Africa to assist in the Ebola response. Contextually appropriate layering of protection means something very different for you there than me sitting here at Mayo Clinic in Rochester, Minnesota. Similarly with SARS-CoV-2, the preparations that should be done, the layers of protection in the midst of an outbreak occurring in your community is very different than for us in the Midwest right now, where we're really not seeing much activity. Nonetheless, I'll tell you that the most effective maneuver we know, by far the most effective, is appropriate hand washing.
I was hoping this was coming.
Even at our ID conventions, when we do studies, observational studies, it is apparent that virtually no one knows how to properly wash their hands. When you interview them, they all believe they know how to wash their hands. If you go to YouTube and you search for Dr. Polin and Jimmy Kimmel, you'll see a hand washing skit we did where we use a substance that glows under a black light, sort of, simulating what bacteria and viruses might be on your hands.
I think we might be sharing a link with that.
What you really have to do, and how do you properly wash your hands, which is a far better maneuver, by the way, than hand sanitizers, but hand sanitizers are a second best.
Right.
That, covering your cough and sneeze, washing your hands before you touch your face or eat food are really important things. And they work along with social distancing.